Hi, NewBeauty followers. Welcome to another NewBeauty Talks. I'm features editor Tatiana Bito, and today we are talking to Wayne, New Jersey facial plastic surgeon, Dr. Jeffery Wise, and we're talking about everything eyes. So if you wanted to know and you've wanted your own consultation for an eye procedure, injectables, Dr. Wise is going to walk us through that, and he's going to let us know why eyes are trending so much right now. Also, if you have not picked up our NewBeauty spring issue, I know it's the beginning of June, but this is still on newsstands, and it has our 11th annual NewBeauty Award winners in here, and you're going to want to pick it up with Catherine Zeta-Jones on the cover. There's so many good stories in here. So, and of course you want to see all of the products that won. So if you haven't picked it up, you can still pick it up. It's still on newsstands. Let me patch in Dr. Wise. 1 second. We are connecting. And if you have any questions, go ahead and type them in for us, and Dr. Wise will be ready to answer them for us. Hi, Dr. Wise. How are you?
Hey, everybody. How you doing? Hi, Tatiana. How are you?
Good. So eyes are having a moment.
Indeed.
And which eye procedures are trending the most at your practice?
The most common procedure nowadays have been the upper and lower blepharoplasty procedures. We do a ton of other eye procedures such as laser, fillers, etc. It seems like, eyes are having a moment because of the whole Zoom thing. I think so many people are on Zoom right now and seeing themselves, really close up and realizing they look a bit tired. And eyelid surgery is just a great way to kind of refresh your look.
I actually saw a procedure once, and the patient was still awake, and it was in the office. It just seems like not a huge undertaking like I thought it was.
Yeah, I mean, of all the things I do in my practice, eyelids are probably among the most common procedures, and it is indeed, you're correct about that. It's an office-based procedure. It's almost, I would say, not even standard of care at this point to do this under general anesthesia, with a breathing tube. Most doctors do this under sedation anesthesia, so, a little medicine to make you more comfortable. My patients generally for this procedure are essentially asleep, but they're sedated, they're breathing on their own. And it's a same-day procedure. You go in, takes a few hours, and you're done.
Okay, we always hear about upper and lower blepharoplasty. So let's break it down into who's a good candidate for which one, and who really needs both.
Of course.
Who's a good candidate for upper eyelid surgery?
So the ideal candidate for an upper blepharoplasty is an individual, male or female, of course, who essentially has excess skin and some excess fat above the eyelids. The typical candidate has kind of a bit of a tired look, a little bit of a heavy look. They feel as though their eyes don't really pop as much as they used to. A lot of my patients complain that they have difficulty applying eye makeup. That's a big thing. They're like, all of a sudden they can't really navigate their eyelids. They really have, they kind of lose that eyelid platform. So they really want to kind of get all that back. And that's the ideal candidate for an upper blepharoplasty.
So anything where there's hooding or a shape change up top?
Correct. That's exactly right. Everything up top.
Okay, so for a lower blepharoplasty, who is the best candidate for that?
So a lower blepharoplasty, if the upper blepharoplasty, is all about, not all about, but primarily about excessive skin and tissue. A lower blepharoplasty, on the other hand, most of my candidates for lower blepharoplasties actually have an excess of fat under their eyes. And they have like the bags, right? We talk about, oh, my eyes are puffy and they're baggy. And, no matter what I do, of course, there's good days and bad days with lower eyelids. You can have days where they're not as puffy. But the truth of the matter is that regardless of lotions and potions and cucumbers and tea bags and all that stuff, there is some fixed anatomy there, and that's really eyelid fat. Now, this fat, people always ask me, if I lost some weight, will my eyes also lose weight? And the answer is absolutely not. This is hereditary fat. People can gain 100 pounds, and the fat under their eyes isn't affected. So it's really a whole different animal of fat that is 100% hereditary. And people also ask, well, what do I do to to get this? You know, where did I go wrong? You know, and the
Right.
answer is that you didn't do anything wrong. This is one of those things that, unlike a lot of issues, is 100% your genetics. So that's really
Okay.
all there is to that.
So it's not because I slept on one side or I was
No, I
out in the
mean,
sun too long or I didn't wear eye cream. It's you
I
can't
mean,
control it.
I'm not saying that those things have absolutely zero to do with what we're talking about, but at the end of the day, like this is just one of those things that, like, you know, your parents or relatives may have this, and you were lucky enough to get it as well, and that's it.
Okay, we have someone asking, what about under eye hollows? You mentioned fat pads, but if the area
Yeah,
is hollow, there's not fat there,
yeah. So
does a lower blepharoplasty fix that too?
the answer is yes. There's a couple of options for lower eyelid hollows, and it's really done on a case by case basis. But I will tell you that that's really where the dermal fillers come in very, very well. A lot of times we'll do tear trough dermal fillers to that area, and that could be very, very effective. I will tell you that oftentimes people mistake the fact that they have a ton of eyelid fat, and that fat, or that mountain, if you will, causes a resulting hollow. So it's really
Right.
not the tear trough. The tear trough is actually created from the fact that they have a lot of fat. So there's a mountain, and as such, there's also a valley. So they kind of notice the valley, but in reality, a lot of it actually has to do with the fact they have some fat there. But it's really the kind of thing where you have to just, you know, analyze the eye carefully and talk to a physician who does this procedure.
So it's like an optical illusion in a way, right? It's
To an
not like
extent.
it's, yeah, you're
Yeah, I
not
mean,
actually hollow, you're just bigger somewhere else.
yes, I mean that's not universally true, but a lot of times
Right.
patients will say, you know, gee, I can't stand this hollow under my eyes. And in reality, it's really not a hollow. It is a hollow, but it's a hollow created by protuberance, or what we call pseudo herniation of fat.
Okay, Louis and Jesse says, shouldn't this be done by an oculoplastic surgeon, especially if you have prominent eyes? Just curious.
Yeah, no. So that's a great question. There are a number of specialties that perform this surgery. Anyone who does a lot of these in the fields of general plastic surgery, facial plastic surgery, and oculoplastic surgery are all really good candidates. For functional eyelid surgery, particularly if someone has something called ptosis, where it's actually a problem with the musculature of the eye, where they can't actually open their eye, I refer all those to an oculoplastic surgeon, because they're at least the ones that I deal with are very adept at handling functional eyelid issues. But for general cosmetic concerns with blepharoplasties, any of the specialties could be good for this procedure. But you just want to make sure your doctor performs a ton of them.
Right.
The reason I'm wearing my funny hat is because I literally just came out of doing one. So, you know, I do probably, in my practice, I probably do anywhere between 5 and 10 of these a week.
Wow.
So you just want any doctor who does a lot of them and is very comfortable with the eyelid anatomy and the aesthetics.
Okay, so we have two more questions coming in.
Sure.
One is, can I ask who is a good candidate for Kybella? Now, Kybella is not FDA approved for use around the eyes, so
Yes.
I'll let you take over. And then the other question is, what about a fat transfer under the eye? So what about those two options?
Yeah, so those are excellent questions. In my practice, I've never been a fan of injecting Kybella around the eyes. I think it's ill-advised. I would not recommend it. If you find a practitioner that is very comfortable with that, then you know, and
it's
you're
not.
comfortable, then go for it. But it's really, you know, you have to understand that the Kybella or deoxycholic acid is a very it's a powerful drug, and it could affect nerves that surround the area, and you have to be really careful with that. So I routinely do not use Kybella almost ever. In fact, I don't think I've ever used it around the eyes, and I would not generally recommend that. As far as fat transfer, yes, to answer your question, I do autologous fat transfer, where we take fat from like the abdomen or the leg or somewhere else on the body, and we process it into the fundamental stem cells, and we inject that into a hollow area. So that is something that could be done. Something that I enjoy even more, that I think is more predictable and reliable, is actually something called fat repositioning. So what that is essentially is we take fat from the eyelid, where we actually remove some of the fat from certain areas, but we also take some of that fat and it's attached to its own blood supply, and I move it to different areas where there's a hollow. So in my practice, in my hands, I routinely perform fat repositioning, but I don't as frequently perform fat transfer, and that's only because I find that in my hands and a lot of other doctors, fat repositioning gives you a more predictable result, and so I prefer it.
Is that because you're taking the fat from the same area, so it is like thriving in that area more than taking it?
That's absolutely correct. You know, what it really comes down to is not only is it a good match because it's fat in that area, it's not fat from, let's say, your abdomen or your buttocks. What I like about it is it's actually pedicle fat, meaning that we actually don't have to remove it completely. We can actually stretch it to another area, and it has its own native blood supply. And so therefore the fat does beautifully. It doesn't, there's no, it doesn't dissolve, it doesn't go away,
Right.
It doesn't resorb. So it actually stays exactly the way we leave it. So that's why I really like it.
And then we have another question. Does putting fat or repositioning fat, like you said, does that tend to last longer under the eye than placing filler under the eye?
Yeah, so 100% yes.
Okay, yes. And then
yes.
you mentioned before, when you do a fat transfer that's coming from a different place, you mix it with stem cell, with is it PRP?
We typically combine it with PRP, but fat in and of itself does contain a lot of what we call pluripotent stem cells. So you don't necessarily have to mix it with PRP. Sometimes as an added ingredient, I will add PRP to the batch.
Interesting. I like the fat repositioning because I'm picturing it that it's not actually like coming out. It's just like being moved around where you want.
Yeah, we're like, think of it as like we're like rearranging the furniture. You know what I mean?
Right.
That's what we're doing. We're taking, you know, the coffee table, we're moving it over a little bit. That's what we're doing.
It's the feng shui of the eyes.
Yes, that's exactly correct. That's exactly what
okay. We have.
Yes.
We have another question. If you do get an upper or a lower blepharoplasty, how long is it permanent, or how long should you expect your results to last?
Yeah, so the wonderful thing about eyelid surgery is, as I said, it's relatively non-invasive. It's routinely performed. It doesn't require deep anesthesia, and the most amazing thing about blepharoplasty is that it lasts many, many decades. So if a blepharoplasty is done correctly, which, you know, you have to find the right doctor, of course, to do it successfully, it really should last you many, many decades. I don't like to tell people it's forever because,
right.
You know, if you do an eyelid, you know, do a blepharoplasty as someone who's 30, you know, who knows what they're going to look like as they age to 80 years old, right? But
right.
in my hands, you know, blepharoplasties essentially last many, many decades.
And are you seeing patients that are coming in this era being a little bit younger than they used to be? Like, I think of my parents when I think of blepharoplasties, but now I'm seeing people my age getting blepharoplasties for whatever reason, because you don't have to be an older age to have any of these issues. So
no, I mean,
is the trend going younger?
Yeah, we see this all the time. I mean, you know, remember, there's a lot of people that have this hereditary pseudoherniation of fat. For instance, there's beautiful young people in their 20s who have bulging eyelid fat, and that's just something that they were born with, and they'd like to remove it. And so people are getting blepharoplasties as early as their 20s, and that's it's not an unreasonable thing to do, especially when you have some of these issues.
What about crow's feet? Because a lot of people, that's the first real sign of aging when you're getting into like your late 30s and your 40s. All of a sudden, you have these lines radiating from your eyes. So, what?
Like where'd that come from, right?
Yes, yes. It's hard to look in the rearview mirror when I'm driving because I'm like, oh no.
Yeah. So it's a very common issue. You know, most of the time, if someone has crow's feet and nothing else, I'll usually start them out with a neurotoxin such as Botox.
Okay. So Botox is the answer for that, or neurotoxin.
Crow's feet by themselves without anything else. It's really not a surgical correction. I really would recommend one of the neurotoxins like Botox or Dysport, Jeuveau, Xeomin.
And then I've also recently we're hearing a lot about thread lifts.
Yes.
Are thread lifts recommended for the eyes? And I'm also seeing it as more of a way to like reshape the eyes than a rejuvenation treatment. Is that what's the story with thread lifts and the eyes?
Yeah, so there are some physicians and practitioners that are performing thread lifts to raise the corners of the eyes to create maybe a slightly more like a cat-like appearance. It's not something I routinely do in my practice. I don't really love it. My experience with threads, unfortunately, I see a lot of the sort of the negative aspects of thread lifts because people that have complications oftentimes will see me in a consultation. You have to be really careful with them. They can have, there is a slight risk of thread extrusion where like you see it going through the skin or infection and stuff like that. So I would caution people about thread lifts as a routine practice, but in the right hands, I'm sure it's a good procedure.
What about a brow lift? Do you do a lot of brow lifts in combination with your eye surgeries?
Yeah, absolutely. I mean, brow lifts, to your point about age stratification, most brow lifts are not performed on very, very young people. I will say that, the youngest brow lift I've ever done is someone usually in their 40s. Brow ptosis or brow droopiness is a little bit more commonly associated with aging. There are some people, of course, there are exceptions, right? There's some people that are younger that have some sort of hereditary issue where their brows are greatly mismatched and we can match them better, stuff like that. But most brow lifts are performed in a slightly older age group.
Okay, Louie and Jesse is asking one more question. Will I get the same result if I had all therapy around the eyes versus surgery?
Yeah, so we perform Ulthera or Ultherapy commonly in my practice. There's absolutely no comparison between Ulthera and surgery. So we like Ulthera as an option for the eyes. We think it's a great option, but it has to be the right candidate. So really, people in the earlier stages of eye aging are really good candidates for Ulthera, but it's really not a substitute, if you will, for a procedure. So you're not going to get a surgical result with Ulthera. It's simply impossible. Right.
And for surgery, how long should you expect to be in recovery? How long is downtime?
Yeah, so we talked about it being a same-day procedure. You go home the same day. Most patients, have incisions or sutures that the stitches usually stay in for approximately 1 week, give or take a few days. And usually, I recommend that patients can wear makeup anywhere on their eyes, including the eyelid incisions themselves, and they could wear makeup within about 10 days of their procedure. So I tell people if they want to be private about it, maybe give yourself 7 to 10 days. But functionally, they're fine. They can see perfectly when they leave here. They can function perfectly at work. Working from home is absolutely fine.
You can read your emails.
Sorry?
You can read your emails in those 10 days and respond.
You can still go on Instagram. You can read your emails, all that stuff. It's all there for you. Yeah, you're really functionally you're absolutely fine. It's just a matter of aesthetically or cosmetically. If you want, if you really don't want any of your colleagues or friends to know about it, you probably have to be a little reclusive or kind of stay inside or by yourself for maybe 7 to 10 days.
Yeah, but that's not really that much. And what about and like you said, like the non-surgical procedures, you're not going to yield the same type of result. You're going to have to keep going back.
No, I mean, look, I'm very lucky. In my practice, we really wear different hats. We wear a surgical hat, and sometimes we wear a non-surgical hat. So I have no problem with the less invasive procedures. In fact, the goal is to do the least invasive procedure possible and still get the great result for the patient. So certainly, there are some patients that are excellent candidates for non-invasive or non-surgical procedures. But that said, there is a point in which there is pathology in the eyes that are there that don't yield the same results with a non-surgical procedure.
We have another question. My only concern is ptosis for lower eyelid surgery. How often does this happen?
Ptosis for lower eyelid surgery? Was that the question?
Yeah, I'm wondering if
I think what they mean, and they could clarify this if they want. I think what they mean is someone with what we call lower lid malposition, and what that means essentially is that the eyelid droops or it becomes rounded, or even you see the red part of the eye after a lower eyelid surgery. So the straight answer is that should never happen in the right hands. We perform a special type of blepharoplasty without getting into the weeds. We do something called a muscle suspension blepharoplasty in my hands, and that basically eliminates the risk of having any sort of lower lid position because it tightens up the lid from below, and so you don't get those kinds of weird shapes to the eye.
Okay, and then is there, I have another question about the non-surgical, because I've seen too sometimes that filler doesn't really correct, you know, like it just, I feel like sometimes it just puffs out a little bit. Are there people who are a better candidate for filler than not?
Yeah, so one of the big things that I see, so the number one filler complication that I see in my practice from other providers, you know, as I said, people sometimes come in for corrective stuff. The number one filler mistake that I see from other practices is filler injected underneath the eye. So people that, and usually these aren't bad providers, nothing's terrible has happened, but they're just not good candidates for this. So you have to really be careful about choosing between someone who is a really good surgical candidate is not always a good filler candidate, and vice versa. So you got to be really careful about this. The biggest mistake that I see is that people are injecting fillers in patients who at the end of the day really should be having a lower lid blepharoplasty.
Yeah.
So that's a very, very common kind of misfire that I've seen.
Well, tear trough filler has gotten a lot more popular in the last few years. It wasn't something that was like on the tip of everyone's tongue, and now all of a sudden it is. So I agree. I don't think it's the answer for everyone, especially if you want a more natural look, but it is a solution for a lot of people.
Absolutely. And let me tell you, tear trough filler with the right candidate and the right provider is really incredibly effective. It could be very, very rejuvenating. And filler under the eye could last a good long time. And it could last 6 months, a year, sometimes even longer. So
it really depends who you go to, for sure, because a lot of it is marketing just to get people to come in, but you have to go to an experienced injector who knows what's going to work for you and what's not. So we talked about recovery, we talked about brow lifts. What advice do you have for someone who is on the fence, they're thinking about it, and they're not sure if they want to do it yet? If I'm speaking about eyelid surgery.
Yeah, I mean, it's, you know, well, for one thing, I never talk people into surgery, so you just have to be ready for yourself. You have to be willing to give yourself some time to recover. There's obviously financial implications, but it's just the kind of thing where you just have to, it has to be the right time for you. And you just have to make sure you go to a provider that, you know, or a doctor that you feel good about. So if it's not the right feeling, or you have like your spidey senses tingling, then get another opinion or simply wait.
And then when you're looking in the mirror, are there certain things that you should look for where you can even tell yourself, like, okay, that's probably something I should go in for a consultation for?
Yeah, I mean, basically it's puffy eyes. They just, you know, you got these bags, you know, and no matter what you do, they don't go away really. You may have good days and bad days, but they're just stubborn. And then the other thing, of course, is that the heaviness of the eyes. You know, you see extra skin. You know, you might be trying to apply makeup. It's just not going like as well as it used to. You know, these are kind of the telltale signs of lower eyelid surgery. If someone always tells you, or your friends or colleagues or whoever says, "Gee, you know, you look tired," you know, first of all, no one ever likes to hear that. But secondly, if you do hear that, frequently it's really about your eyes.
Right. Wonderful. Well, thank you so much, Dr. Wise. This was really insightful, and I know a lot of people appreciate the information. It's like having a mini consultation with an expert. So
I'm always happy to talk to you guys. It's really a lot of fun, and you know, when you love something, you don't mind talking about it. So it's my pleasure. I'll come back anytime.
Perfect. We actually have another question coming in before I let you go. Since you're a facial plastic surgeon and this is your wheelhouse, do you have any alternatives to a neck lift for a 55-year-old woman?
All right, we're starting to move south a little bit now.
Yeah, we're going down.
Yeah, I mean, you know, there's some really good devices out there. We've been doing an off-label treatment called hyperdilute radiesse. We've really been enjoying that here. It kind of tightens up the neck with filler.
Okay.
We've been doing things like Ulthera, that's been around for a long time, but it really works really nicely for moderate laxity of the neck. There's always neuromodulators like Botox for platysmal bands, like the bands that people get sometimes, and even doing like a liquid facelift where we do fillers around the jawline area. It's been a real game changer for my practice. I really enjoy doing it. It's so fun, and the results are like amazing, really cool.
Well, thank you so much. I hope that answered your question, Soraya, and we're lucky to have you. You can talk about all of this. So
Yeah, I can go on for days.
thank you so much. Have a wonderful evening, and thank you everyone for tuning in, and we'll see you next time, Dr. Wise.
All right, hey, it was great talking to you.
Bye-bye, guys.